Hello, my dear students. Today we're going to talk about supports of uterus. You know and I know this is an extremely important lecture. I'm Dr. Vaishali Bharambe. I've been teaching anatomy for more than 25 years and I love it. But today, as I speak on this very relevant topic, I understand the importance of the topic I'm going to talk about. Just imagine the plight of a woman who is living in the interior of our country, who keeps on feeling her uterus sliding out, and she can do absolutely nothing about it. So let's think about her. Let's think how we can help her. Let's see how we as medical fraternity in the delivery room can take all the necessary actions so that she doesn't need to be reminded that her uterus needed support. Let supports of the uterus be a default for every woman out there. I hope you understand what I'm saying. At least you should at the end of this lecture. I understand the gravity and the importance of the topic I will be discussing today. I hope you do too. Just remember, this lecture is going to be divided into description of ligaments, true ligaments, false ligaments, after which I will be discussing supports of uterus. Notes on all this, the entire set of notes are present in the form of handouts on my website vbanatomy.com. Some of you might want notes despite the video being available. Please access them from my website. Just keep studying, keep understanding, keep focusing on the beautiful subject that is anatomy. Right. So let's talk about ligaments of uterus, dividing them into true ligaments and false ligaments. Understand that true actually support the uterus. False are peritoneal folds, which appear to be there but actually do not support the uterus. Does that mean that they have no function? No, they do have a function, but that is not supporting uterus. Right. So let's talk about true ligaments first. First, let's talk about round ligament of uterus. As we know, it's a remnant of gubernaculum. Extends from the lateral angles of the uterus downwards forwards through the deep inguinal ring, through the superficial inguinal ring into the labium majus. Measures about 10 to 12 centimeter in length. Okay. Pulls the uterus forwards in an anteverted, anteflexed position. So here is the angle of cervix, here is the angle of vagina. This is the angle of anteversion, 90 degree. This is the axis of uterus, this is the axis of cervix. Angle between them 125 degree, angle of anteversion. Why are we talking about this? Because these angles are maintained by the round ligament of uterus, which keeps the uterus pulled forwards, and this situation prevents the uterus from prolapsing out, and therefore the position or the angle of uterus itself prevents prolapse. Moving on to the set of ligaments that hold the cervix in place. Okay, so what happens is from the cervix, the surrounding endopelvic fascia thickens to form three very important ligaments. Actually, they're all the same, but because they get slightly more thickened at places, they're called three separate ligaments, which triradiate out from the cervix on both the sides. Okay, pubocervical, transverse cervical, and the sacrocervical or uterosacral ligament. Let's learn about them. In which plane do you find these ligaments? You find them at the level of the cervix, above the levator ani muscle. So pubocervical extends from the cervix forwards onto the pubis, having a pathway which is on either side of the urethra and the urinary bladder. Its pull is balanced back by the uterosacral ligaments. These are uterosacral ligaments which counter the pull of the pubocervical ligament. So uterosacral ligaments from the cervix on either side of vagina, they go and get attached to S3 segment or third sacral segment. Okay, they balance the pull of the pubocervical and round ligament of uterus. That's the uterosacral ligament. Right. So now take a look at this. You're looking from the top, okay? So that's the pubocervical pulling the cervix forward. That's the uterosacral, okay, which is attaching the sacrum to the cervix. Pubocervical attaching the cervix to the pubis. Okay, these are, so this uterosacral ligament, this also acts as a conduit for pelvic nerves, etc. to reach the viscera. Now, next ligament, crucial Mackenrod's ligament, attaching the cervix to the lateral pelvic wall. Attaching the cervix to the lateral pelvic wall. Okay, so that's the uterine artery and the ureter. That's the broad ligament, and this is the levator ani muscle. In between these, here is the Mackenrod's ligament or transverse cervical ligament, attaching the lateral walls of the cervix to the side, attaching tightly to the superior fascia covering levator ani muscle. Superiorly related to the ureter and the uterine artery passing over it, called as water under the bridge. Sometimes the ureter might pass through the Mackenrod's ligament. You must watch out for this and prevent any damage to the ureter. Below this, of course, it's related to urogenital diaphragm and contents of superficial perineal pouch. So what are the different names for this famous Mackenrod's ligament? Transverse cervical ligament, cardinal ligament, lateral cervical ligament, okay, and so on. If you're liking this lecture, do like and subscribe to my channel. Share your thoughts on the comment section. Share the lecture with your friends, okay? Right. Let's now go to false ligaments. What do we mean by false? Are they not there? They're there, but they just don't behave as ligaments. They are folds of peritoneum doing their job very well, but not supporting the uterus. First fold, utrovesical, passing from the uterus onto the surface of the urinary bladder, forming a fold of peritoneum called utrovesical fold. Can it support the uterus? No, it cannot. Similarly, posteriorly, there is a fold called as recto-uterine fold, where the peritoneum passes from posterior fornix of vagina onto the middle part of the rectum. So here is a transverse section through the pelvic cavity, where here's the urinary bladder, here's the uterus, and in between them, the peritoneum folds from one to the other, forming a utrovesical fold. Similarly, here's the rectum and here's the uterus, and the peritoneum folds from rectum onto the uterus. This is called rectovaginal fold. Is it a ligament? No, it's a peritoneal fold. Similarly, there are folds of peritoneum running over the uterosacral folds. Remember uterosacral folds attaching the cervix to the sacrum? They will also be covered by peritoneum, forming recto-uterine folds. Okay, and these in between these recto-uterine folds, rectovaginal fold, and uterus and rectum, a pouch is formed called as the recto-uterine pouch of Douglas. Now let's talk about the broad ligament here, which is a double fold of peritoneum extending from the lateral wall of the pelvis, okay, dividing the pelvic cavity into an anterior cavity and a posterior cavity. So what is broad ligament? It's a double fold of peritoneum. It's like you've dropped a peritoneum layer on the uterus, okay, extending from the lateral border of uterus to the lateral pelvic wall. Either say that like this, okay. It is divided into mesosalpinx, a fold that suspends the fallopian tube. Mesovarium, a fold that suspends the ovary posteriorly. Lower part, which is the mesometrium, and the suspensory ligament of ovary, which suspends the ovary from the lateral wall, helps blood vessels reach the ovary through this fold. So you saw ligaments of uterus divided into true ligaments and false ligaments. You also understood that false ligaments have a purpose, but that purpose is not supporting the uterus. So we now have discussed ligaments of uterus and cervix, but we have to discuss supports of uterus. What are the supports of uterus? Is it only all these or is there something else? Let's discuss that. So, to understand supports of uterus, it's important to understand the anatomical position first. The uterus is situated such that it's anteriorly related to urinary bladder, posteriorly related to the rectum and the ovaries, laterally related to the two uterine tubes, inferiorly continues as the vagina, and its axis is axis of anteflexion 125 degree, anteversion 90 degree. With this basic in place in our brain, let's look at single page of supports of uterus. Feel free to take a screenshot of this. So supports can be divided into muscular supports, ligamentous supports, angulation or position supports, peritoneal supports of false ligaments, which is very minimal, visceral supports, and packaging material. Right? So let's do these one at a time. Looks very long, but is not, believe me. Okay, we are actually in the second half of our lecture. You're going to enjoy this. So let's talk about familiarize ourselves with the pelvic floor. So that's the uterus, vagina, cervix, uterine artery, and ureter, covered by peritoneum, broad ligament, supported and held in place by the Mackenrodt ligament, related below to the pelvic diaphragm, levator ani muscle, supported from below by the urogenital diaphragm or the deep perineal pouch. Below that, superficial perineal pouch and subcutaneous tissue and skin. This is what the whole pelvic floor is all about. We need everybody coming in to support. Okay, everybody is going to play a role here. It's not only ligaments directly supporting the uterus. All structures between pelvic cavity and the surface of vulva and perineum will support. Okay, so Mackenrod's, levator ani, urogenital diaphragm, superficial perineal pouch, everybody is going to do supporting. So let's talk about muscular supports first. Levator ani muscle forms like a little, diaphragm that just completely extends from wall to wall of the pelvic cavity, preventing structures from popping out. So what is this levator ani? It's made up of various parts, okay? One is a pubovaginalis part, okay, which is fibers coming from the pubis winding around the vagina and urethra, partly attached to the perineal body, okay? They help to narrow the urogenital. Can you see a gap here? This gap is called urogenital hiatus. So these pubovaginalis help to narrow the urogenital hiatus, preventing prolapse, okay? Take a look. So here is your urinary bladder, here's the vagina, and this is the gap, hiatus vaginalis, and that's the pubos vaginalis winding around it, preventing these structures above from popping out down, causing prolapse, constricts the vaginal opening. Similarly, levator ani consists of something called puborectalis, a set of muscles that wind around the rectum anal canal. Now you must be thinking, what has rectum got to do with support of uterus? Take a look. So here now you're seeing puborectalis, okay? This bunch of fibers is puborectalis, which is winding around the rectum, okay? So what happens? It holds the rectum in this kind of a bent position. Rectum is coming from here, bending, and then continuing as anal canal. So what happens? Your vagina comes and rests on it. Take a look. Can you see the vagina resting on the rectum here, separated by the fascia in between? So the vagina is resting like a king on the rectum. What happens if the puborectalis is cut? The angle between the rectum and anal canal straightens out. Now the vagina does not have an angle to rest on. The uterus promptly retroverts and extends out, causing prolapse. So this angle is acting like a support to the posterior wall of vagina. Okay? So that's how puborectalis acts as a crucial support for preventing prolapse of uterus. Maintains the curvature of anorectal junction. Let's talk about perineal body. Very, very important. Okay. So here in the center, you can see the perineal body. Funnily enough, perineal body I've always thought of, like if you saw a balloon and at the lower end of the inflated balloon, you have tied a thread. And when you cut off the lower end, okay, the whole balloon opens out. That's what happens in the perineum. Okay, if the whole lot of muscles are attached to this single body called perineal body, levator ani is attached, the contents of deep perineal pouch are attached, superficial perineal pouch are attached. Everybody is attached to perineal body, somewhat like the balloon. Now you go cutting off the balloon, lower end of the balloon, the whole balloon is going to open out. Same thing happens in deliveries when women land up getting a damage to the perineal body, and if it's not repaired, then the vaginal opening becomes very large and the uterus begins to descend down, prolapse. I suggest you do this exercise. Just pretend that you're holding a ball in your hand. The point where your two hands are meeting is the perineal body, and you're holding the uterus comfortably. But one day, the perineal body is damaged. Because perineal body is damaged, the supports, slowly the two sides of the walls open out and the ball falls down or the uterus pops down. This is prolapse related to perineal body. I hope this helped you to understand. So we've done muscular supports. We've talked about levator ani, pubovaginalis, puborectalis, urogenital diaphragm, perineal body. Let's move on to ligamentous supports. Ligamentous supports consist of three ligaments radiating in three different directions. Mackenrod's ligaments, the uterosacral ligaments attaching to the sacrum, the pubocervical ligament attaching to the pubic bone, and the Mackenrod's ligament attaching the cervix to the walls of the pelvic wall. So very strong ligaments which almost hold the cervix in place. We can say cervix is fixed. Prevents descent of uterus through the vagina. The Mackenrod's ligament can be lacerated during childbirth, and this is a cause of prolapse of uterus. Important cause of prolapse of uterus. Let's talk about angulation. So here you are seeing the round ligament of uterus, which is holding the uterus in anti-flexed, anti-verted, anti-flexed position. Anti-verted, anti-flexed position. 125 degree, 90 degree. No uterus can prolapse out in this position. But were you to retrovert the uterus, it would slide out. Okay. So the whole angulation of the uterus prevents prolapse. You can see that happening here. Retroversion has brought the uterus axis in line with the axis of vagina. This can begin the prolapse. Let's talk about peritoneal supports of false ligaments. We know that false ligaments have a very minimal role to play in supporting the uterus. Let's talk about visceral supports. So this is obvious. If there is viscera around it, it's going to support the uterus. For example, anteriorly, the uterus is literally lying on top of the urinary bladder, which supports it. Posteriorly, the anorectal junction, as you can see, supports it. Okay, and funnily enough, the posterior wall of the vagina thickens to form something called cervical cushion. The cervix goes and rests against it. Okay, so all these viscera seem to support each other. Finally, let's talk about parametrium, the packing material. All these visceral organs are there, but there is this fantastic packing material which is firm, which is fibrous, which contains fat. What it does is it packs up all the empty spaces so that it acts as a fantastic packing material supporting the uterus from all sides. The blood vessels in this form what is called chorda vasculaire. Okay, the blood vessels itself in the parametrial sheaths begin to support the uterus by their presence. You can compare this to the supports of liver, where the hepatic veins attached to the inferior vena cava actually supporting the liver, which is hanging high in your abdominal cavity. Similarly, the uterus also is supported by the blood vessels that supply it, which is called as chorda vasculaire. So all these are supports of uterus. You must always think of them in a systematic manner to get all supports back in place when you're writing your answer. Okay. So in today's lecture, we talked about true ligaments and false ligaments. Then we talked about discussion on the uterus, how not only the direct ligaments support uterus, but there are various layers in the pelvis which support the uterus. Levator ani, urogenital diaphragm, parametrium, physical support by urinary bladder, by the anorectal junction, by even the posterior wall of vagina itself, the blood vessels, everybody supports the uterus. Effort is always to prevent a prolapse. Remember, notes about this lecture and all my lectures in the form of handouts are available on my website vbanatomy.com. Please access these notes. This is for all of you who have been repeatedly messaging to me that, ma'am, can you provide notes? Yes, now the notes will be provided. Just go to vbanatomy.com and begin to study them there. So students, if you like this lecture, do like and subscribe to my channel. Share your thoughts in the comment section. Share the lecture with a friend. I hope this has helped you to answer the very crucial question of supports of uterus and the very crucial problem of a woman who has a prolapse of uterus. Okay, students, I hope this has helped you a lot. This is a very important lecture. Thank you so much. I'll see you across the screen in some other video. Thank you. Bye.